Good afternoon. Thank you for joining the class today. Today, Abha is not going to be here, and I'm going to take care of the class for Abha. Most of you probably know me. I'm Dr. Dilip Sarkar. We've been teaching to me and Abha for a long time. I have to share a bad news with all of you. Due to this COVID crisis and the situation, what is going on in India, Abha lost her father. Abha lost her father 2 days back in India from COVID-19. And I'd like all of you to have a moment of silence for his soul to rest in peace, and also for Abha to overcome the loss of his family. Please sit down with your spine straight. If you're sitting in a chair, sit the spine straight. Sitting in the ground, keep the spine straight. Touch your index finger and thumb. Put it over your knees. Close your eyes and observe a moment of silence. Okay, slowly put your both the hands together and keep rubbing your hands. Keep rubbing your hands, and when you feel the nice and warmth in both of your hands, if you're wearing glasses, you remove your glasses. Take both the hands like a cup, called pumping and cupping. Put it over your eyes. Let the eyes take all the heat from your hand. Then slowly massage your forehead. Massage your eyes, massage your face, massage your ear, back of your ear, front of your ear, in the ear canal. This is called the auricular branch of vagus nerve. It really quiets down your mind. Massage in the front of the neck, back of the neck. Welcome to the Sunday class. You do go through a set of practices, but today I thought, since we have a loss with the COVID-19, and we've been finding it out with our experience, with our research, that yoga as a therapy is providing a tremendous success for people with COVID-19, both as a prevention, both during the COVID-19, and also it's a wonderful practice for called a post-COVID-19. You might have heard this by now. The post-COVID-19 is also called a long hauler syndrome, and many people after COVID-19, and they're going on for almost 3 months, 6 months, sometimes a year. And it's a large number, between 10 to 30% of the population with the COVID-19. So let's look at the components of COVID-19. First, all of you know by now that COVID-19 is a respiratory virus. The word COVID came from, CO comes from the corona, VI comes from the virus, D comes from the disease, and the 19 comes from 2019. It's a novel virus, it's a brand new virus. It is in the group of called coronavirus, SARS-CoV-2 virus. It enters through your respiratory tract. It enters through your nose and your mouth. It goes to your lungs. It creates a profound inflammatory response. It is called a cytokine storm. That inflammation slowly and slowly fills up the lung. You start developing hypoxia. Your oxygen saturation goes down, and the lung slowly and slowly fills up with the fluid. You won't be able to sustain the gas oxygen of the oxygen and carbon dioxide exchange, and essentially people die from hypoxia. This virus also causes a severe septicemia. Septicemia means the infection in the blood, and septicemia causes multiple organ failure. Practice of yoga creates a relaxation response. It creates a situation called a parasympathetic activation. And all of our research, all of our experience show a relaxation response and parasympathetic activation is powerful anti-inflammatory therapy. The virus also acts directly on many organs like your heart, your brain. It crosses called a blood-brain barrier, kidneys, and also causes a thrombosis. Clogging of the blood vessel is called blockage of the blood supply and causes called a microvascular thrombosis and with organ failure. A relaxation response is also known to be antithrombotic. So let's start first. The first situation, what COVID-19 has created to us. This COVID-19 first created to us a situation of panic, fear, and anxiety. This panic, fear, and anxiety is hurting us more than the COVID-19 itself. So for the panic, fear, and anxiety, let's go ahead and do a few practices. The first practices you do is a stepwise relaxation response. How do you do it? If you are able to sit down in the ground, or if you're able to sit down in a chair, sit-up chair, but keep your spine straight. This straight spine slowly and slowly brings a relaxation response. If you can sit down, you can put your feet underneath both the knees, and knees will come down, and listen to your body signal. The first body signal is pain. If you get a pain, do not cross the limit of your pain. Pain means pay attention. Pain, you back off a little bit. But if you stay in the pose, the muscles cannot stay contracted too long. It is going to start relaxing. When it relaxes, it will come down. Our hand connects our body and mind. Talk with that hand. So touch your index finger and thumb. We just did a practice. Put it over here. And now use the power of your breath to bring a relaxation response. Remember, the COVID-19 is a respiratory virus. What you need to do, you need to strengthen your lung, you need to improve your lung function, and you need to improve your oxygenation. So best way to do it is that the mind will quiet down when you are able to control your five senses. What are the five senses? I hear, I see, I smell, I taste, and touch. The most important sense of the five is vision. So close your eyes. Close your eyes. Now pay attention to your breath. Lung is like a balloon. It has a 6-liter capacity and it needs 1.5 liter to be expanded. 4.5 liter you can exchange. So breathe out first. Take a deep breath in. Breathe out longer than breathing in without any effort. Do a few more times. If you want to count, you can do like a count of 2 in, count of 4 out, count of 3 in, count of 6 out. And the breathing muscles can be trained. So slowly and slowly you can increase the number. We've been doing it for a long time. You can easily do a count of 4 in, count of 8 out. Let's do your 3 breathing. Count of 3 in, count of 6 out. Breathe out first. Count of 3 in. Count of 6 out. Do it a couple of more times on your own time and closing your eyes as quiet as possible. Longer the exhalation, better is your exchange in your lung. And exhalation is parasympathetic. Now, if you're able to sit down in a cross-legged, this is called easy pose. So now, see if you can change your feet and you can sit down. This activates your opposite side of the brain, and it is a powerful, relaxing response because it brings the balance between both sides of your brain. I'm going to teach you or show it to you a little bit more pranayamas, the breathing technique, because that's a pranayama is a therapy for the COVID-19. And also, what you need to do, you need to improve your immunity. When you improve your body immunity, that body will fight against the virus. We are all vaccinated, we have the vaccine, but there is no better than your body's immune system. So the first pranayama, which is very effective for COVID-19, primarily for the symptoms of this panic, fear, and anxiety, and also the symptoms of loss of smell and loss of taste. Loss of smell and loss of taste is one of the very important and powerful symptoms in COVID-19. They are also the part of our 5 senses, smell and taste. So what you do, you shut down your 5 senses, then you create a vibration. The vibration has the same frequency as the brain. 2 frequency cancels, quiets down. You enter into a profound state of relaxation and controlling your 5 senses. It's a Bumble Bee Breathing called Bhramari Pranayama. If you want to practice with me, put your index finger in your forehead. Use your 3 fingers to close your eyes. use your thumb to close your ear and then close your mouth. You breathe out through your nose first, take a deep breath in through the nose, and breathe out with the sound of a bumblebee. So let's start. Breathe out first. Take a deep breath in through your nose. Again, into this pumping and cupping. It's a wonderful relaxation response. Keep rubbing your hands. Keep rubbing your hand. It's called pumping. And a cupping is, if you're wearing glasses, remove your glasses. Use the hand as a cup. Put it over your eyes. Let the eyes take all the heat from your hand. Then you massage your forehead. Massage your eyes. Massage your face. Massage your ear, behind the ear, front of the ear, inside the ear canal. Then bring it to the front of the neck. There is this organ called carotid sinus. Carotid sinus helps you to activate the vagus nerve and to causes the vagus relaxation. You can go ahead also improve your sitting postures in stages. Now we can take your heel to the back and take your one foot in the top, and you'll see your knees drop down. This is called a Siddhasana or a perfect pose. And remember, this will come in stages. And we always say in yoga that in stages, impossible become possible. Let's start relaxing. The most important relaxing is you need to relax your upper part of the body. When you relax your upper part of the body, the muscles which is controlling your breathing, muscles controlling your lung, that get relaxed, and you are able to improve the function of your lung. Hand gets relaxed with a mudra called Adhi Mudra or called baby fist. Baby will close their fist with a thumb inside and close. So let's put your hands in the front. Breathe out first. Take a deep breath in. And breathe out and close your fist. Breathe in, breathe out. Do it a few times and do it with the eyes closed. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Wrist gets relaxed with extension. Breathe in, breathe out. Breathe in, breathe out. When you do your eyes closed, you bring the relaxation very quickly. Put a hand in the shoulder, it is shoulder relaxation. Bring your elbows together as close as possible. Remember, you should not have any pain. If you get a pain here, just find a spot where there is no pain. There is no role of practicing yoga with pain. Do not take any pain medication and practice yoga asana. Breathe out first. Take a deep breath in and slowly rotate your shoulder. And try to do it with the eyes closed. Breathe in, breathe out. Breathe in, breathe out. Do the opposite. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. I practice every single day this relaxation response. Hold your hand high up, hold your wrist, breathe out first, breathe in and pull it down behind your head. Breathe in, breathe out. Breathe in, breathe out. Whole upper part of the body get relaxed when you are able to do a little prayer pose to the back. You can take your hands slowly to the back. I can do prayer pose. Let me show it to you. So let me turn around so you'll be able to see how to do it. And then you will do it on your own and then we'll stay in the pose. Don't get up. Bring your hand. If it is here, let it be here. If you can bring it close here, this is very good. If you can do in a prayer pose, stay in a prayer pose and slowly bring your hands high up, as high as possible. And stay in the pose. Remember, staying in the pose is the relaxation because a muscle, it contracts to put you in the pose in the asana, but it cannot stay longer. True. So I'm also using a relaxation of my lower extremity. So I'm putting my one foot in the top, and then also I try putting the other foot in the top. This is called a half lotus, or it's called swastika asana. If it causes any pain, you can back off a little bit, or you can go all the way down even, but see where you are comfortable and put your feet there. Put your hand in the back as a prayer pose and find a spot where you can do without any pain and stay in that posture. Now we'll be relaxing our neck. Neck relaxation is the fourth posture of our neck, and generally we do it a breathing. So like first, you breathe out first, take a deep breath in, and slowly put your neck to the back. Breathing out, slowly drop your neck in front and listen to your body signal. Be sure there is no pain and you have an effortless breathing. What is the effortless breathing means? You can talk and you can breathe. Another way to do it is very nice way, bring more relaxation. See, when I get more relaxation, my hand keeps on going high up. Another way to do it, bring relaxation is when you can do this with a bumblebee breathing sound. In a bumblebee breathing sound, your exhalation becomes longer and longer. So let me show you one time, then you'll be doing it. So breathe out first, take a deep breath in, put your neck to the back, and breathe out with the sound of a bumblebee as long as you can. So wonderful practice and wonderful relaxation. Also, when you have a relaxation response, you get a saliva in your mouth. Your mouth is wet, like my mouth is wet now. And saliva in your mouth means it's a parasympathetic activation. When you're scared, when you have a sympathetic overdrive, you get a dryness in your mouth. Now drop your neck on side to side with the same sound, the sound of a bumblebee. Breathe out first. Take a deep breath in. Drop your head on the left side with the bumblebee sound. On the right side. all the way to the back without turning your shoulder. Breathe out first, take a deep breath in. Finally, rotate your neck. First, when you drop your head down, from left to the back to the right, and right to the back to the left with the same sound. See, my hand has started going up more and more because of the relaxation response. Breathe out first. Deep breath in. So with this relaxation, my whole body is relaxing. Now my neck is relaxed, for the upper part body is relaxed. So I'm trying also my lower part. See, my ankles are relaxed. I'll be doing my lower part relaxation also. But you can see my whole body is relaxed. So I can easily put one foot on the top. This is called a Lotus Pose. I can sit down in a Lotus Pose. And this is a wonderful relaxation of my lower extremity. I have a breathing technique called breath holding in inhalation along with a chin lock. This is the therapy for COVID-19. When you do a chin lock, you activate called the carotid sinuses. Carotid sinus massage will do to quiet down your whole cardiovascular system. Like when you get a bit of heart rate goes high up with a carotid sinus massage. So I'm going to show it to you one time, then we'll do all together. In the hand, do this baby fist, put your thumb inside and close. It relaxes your whole body, relaxes your hand. See, when your hands are relaxed, see your fingers are all separated. Your fingers will go in and out. You can turn your hand, this is the relaxation of your hand, wrist, and practice it. Because if you're too tight, it doesn't go through. So relax your hands, put it over your knees. Slowly, first what we'll do, you will breathe out first, then we'll take a deep breath in, then you hold your breath. You're holding your breath, then you slowly drop your chin down, touch your chin to the chest, and hold it as long as you can. Let's start, do all together. Breathe out first. Take a deep breath in. And hold your breath. Slowly drop your chin down. Touch your chin to the chest. And stay here. And keep counting as long as you can hold your breath without any effort. you will see you are so relaxed, and then your oxygen concentration will go higher. This is called a Mudra Pranayama. Mudra means you're unconscious. Let's do one more time. Practice it. It's a wonderful practice. Breathe out first. Take a deep breath in. Hold your breath. Slowly drop your chin down. Touch your chin to the chest. And keep counting as long as you can hold. When you have that sense of relaxation, you have a wonderful response. You know, these days, you have this health tracker. This is our Apple Watch. We wear it so you can see all my health parameters. What has it? You can do EKG, you can see your heart rate, you can see your blood pressure, or you can do your oxygen. You can see all of them. So when you relax, see one thing, this is called your Titliasal or lifting. I'm putting my hands on both sides and I'm not pushing myself too much. If you want to try, give it a try. Push it down and your whole body will go higher. The body will go higher and stay, and I can stay here. I can stay here, I can talk, I can breathe. This is a sign of the relaxation. When you have this relaxation, your breathing becomes deeper and deeper. The breathing rate starts going down. So as simple as it is, normally we breathe between 15 to 16 breaths per minute. If you're able to take 2 seconds in, 4 seconds out, one cycle will be 6 seconds. Already your breathing rate will be down to 10. And if you continue this throughout the whole day, this will be a practice. This will be your habit forming, what you call the neuroplasticity, and that's the way you'll be breathing all the time. We can breathe now 4 seconds in, 8 seconds out, 6 seconds in, 12 seconds out, very easily without any trouble. For your lower part of the body, you can put your feet in the front. Put your hands on both sides. Keep your spine straight. First, separate your toes. Separate your toes. Breathe out first. Take a deep breath in. Breathe out. Bend your toes. Breathe in. Breathe out. Breathe in. Breathe out. Ankle relaxation is a powerful relaxer because ankle carries all of your body weight. So breathe in and slowly bend your ankle down. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Slowly rotate your feet. Breathing in. Breathe out. Breathe in, breathe out. Also you can do, it's a nice relaxation of your all and lower extremities. What you can do, you can take your one foot, try this with me, put your one foot, use your hand, fingers in your hand, put in between the toes. This will separate your toes. You will see when you have relaxation, all the toes gets easily, how easily it is goes in and out. If it is tight, it's really tight. You can hold on to your knees. You can bring the knees high up. You breathe out first, take a deep breath in, slowly drop the knee and go all the way down. Very easily. Breathe in, breathe out. Breathe in, breathe out. Knee is a site of fear. Hip is the site of emotion. Stress is nothing but a fear of unknown. So the COVID-19 is causing fear and it is also emotion. So you're controlling both the fear and emotion, and always you always remember to the balancing in both sides. Take the opposite foot, the left hand, put it all in between. Look at the hand goes all in the fingers, and you practice it. Whenever you're sitting down, you practice it. You practice this sitting down, practice this your prayer pose to the back, practice your neck relaxation. You breathe in, breathe out, slowly, this knee will go down. If it is not going down, let's be here, continue your breathing. A longer exhalation will create a relaxation response, and longer exhalation will keep on doing this. More and more into the breathing technique, more and more relaxation will set in. If you push it down, what will happen? Come back higher. It's not going to go down by pushing it down. So really adjusting doesn't help. You can guide somebody how to do it, but he or she has to do it on their own. This relaxes your hips, relaxes your knees, relaxes your ankle. That's the whole lower part of the body. Wonderful relaxation for your hips. And when you have a hip relaxation, it also relaxes your back muscles. This is a closed angle pose, sitting down. Put your feet together, if you can, and put your feet together. So slowly and slowly you bring close to your body. Clasp your hand, put it underneath your feet, and slowly, it's like a butterfly. It is called Titliasal, butterfly pose, and both the knees will start to keep on going down. Keep your spine straight. Close your eyes and do a few breathings. Generally, in a yoga therapy, in a therapeutic asanas, you like to stay in an asana between 5 to 10 breaths. Breathing out longer than breathing in. Breathe out first. Take a deep breath in. And breathe out longer than breathing in. So seeing stages, how did we come up to the relaxation? We came to a lotus pose on sitting down with all the different techniques, and this relaxation is going to help you to fight the coronavirus and to improve your immunity. Also, we do a lot of yogic the rituals in the morning, which are called your daily routine, called dinacharya. Wake up in the morning, we sit down in an asana, which is called your squatting pose. And I'll show it to you very quickly. In a squatting pose, we sit down in the morning and we drink a glass of water. We keep on gulping. We gulp the water, one gulp at a time. And it starts your peristalsis and starts your bowel movement. When you get a bowel movement, all the toxin, all the stool comes out in your body, and you're feeling a freshness. Then daily morning, we brush our teeth and use a tongue scraper. Use a tongue scraper to scrape our tongue. So if any virus is getting through mouth and getting stuck to your tongue, it's going to be removed, and do it daily. This is a daily practice. Then we do the washing your nostril, which is called a jal neti. We use a small pot, called a neti pot, and the neti pot, we put a water in one nostril, it comes out, and do it every single day. So any virus, any allergens, anything, any dirt which is coming through your nose, through mouth, they can all get removed. If you are able to sit down in a squatting pose, which initially may be a little bit of a difficult for most of us, but again, don't try, do it in stages. If you cannot sit down in a squatting pose, you can find out where you can sit down and stay here. Maybe hold into a chair, hold on to something, and then able to sit down. When you're able to sit down in a squatting pose, your knees are relaxed, hips are relaxed, knees are relaxed, hips are relaxed, ankles are relaxed, and your pelvic floor is relaxed. Put your hands together, separate your fingers, your hand gets relaxed. Extend your wrist gets relaxed. Put your one elbow inside, put the other elbow inside. Slowly bring both the hands close to you. Keep your spine straight. Close your eyes and do your breathing. Breathing out longer than breathing in. So wonderful asana for the whole body relaxation. Relaxation every part of your body, and this is a must for practicing and to overcoming the symptoms of COVID-19. Thunderbolt Pose is another wonderful relaxation of the whole body. So let's try to see how you do it. First, you are able to sit down. Maybe you try sit down on your heel and keep your spine straight. Many people at the beginning may have a little issue. You can have a little roll of a blanket and put it under your ankle, and you will be able to sit down. Then you can drop all the feet down and you can sit down. Even if you cannot sit down, what you can do initially, you can have a small pillow or have a folded blanket, put it underneath. I like the folded blanket better because in a folded blanket, what you do, when you develop this asanas, you can slowly remove the blanket slowly. So if you're able to do it, sit down in this asana. And this is one asana, it is so relaxing. It is for activation of the parasympathetic tone, that this is the asana we do even a full stomach. After a full meal, we sit down like this. From here, you go down through it's called your moon pose or rabbit pose called Shashankasana. Take both the hands and slowly drop it down as far as possible. And then drop your elbows, head down. This is also like a part of child's pose or a rabbit pose. And stay in the asana. Stay in the asana between 5 to 10 breaths. And you can slowly get up one step at a time. I'd like you to keep practicing this relaxation because we have no idea when this COVID is going to hit us again. We are all vaccinated. We believe in science, but this virus has shown us it can mutate very rapidly. What happened in Brazil, what happened in UK, and what is happening in India today is an entirely different strain. The new strain in India is called a double mutation strain. Now you do, sitting down, do your breathing to improve your lung function. So improving your lung function, first breathing you do is called the bellows, the breathing. Bellows is an active inhalation and active exhalation, and you keep on doing it slowly in stages and do it effortlessly as if it is your normal breathing. So you can raise your hand high up initially, do it very slowly. You take a deep breath in and breathing out, put your thumb inside and close and pull it down. This is called a breathe in, breathe out. Do it with your eyes closed. We'll do it about 10 times and you'll see that slowly you'll be able to do it. If you can speed up a little bit more, a little slower speed, medium speed, and a fast speed. We'll do it in this cycle, just in one cycle. We'll do it about 20 very slow, 20 medium, 20 fast, and we'll repeat the cycles. And you'll see how effective is your breathing after this. Let's do 20 in a slow speed. Let's do 20 with the medium speed. Do 20 in a rapid speed. You have washed away all the carbon dioxide, you bring all the oxygen. Now if you can breathe out first, so how much air you can take out. Now breathe in. You can breathe in and breathe out maybe about 3 times, 4 times. It is almost like oxygen therapy. It is called Hyperventilation Syndrome. We have been doing it for so long. So what we can do, we just sit down and we do in a different speed. But remember, it is exactly our normal breathing. There is no effort in breathing. We're talking, we're breathing. Take your hands there. Just practice if you can do with me. And I'll do it for a short time, just to give you a little sample. continue. But remember what I'm doing. I'm talking, I'm singing. The eyes isn't telling normal. I can do it for a long, long time because I practice every single day. This is the main breathing technique to improve the function of your lung. Remember, you only breathe 0.5 liter, and our capacity is 4.5 liter. 80 to 90% of the lung function we can improve. Air has a 20-21% oxygen. 78% is 79% is a nitrogen and other gases product. So you have to remove all of them to get a more and more oxygen. Next, the Kapalbhati Pranayama, breath of fire. You have a one balloon here, you have a diaphragm here, another balloon here. You look at your belly button, push your belly button to the back, you hit the diaphragm, and all the air will come out from your lung. This is the active exhalation and passive inhalation. Do it very slowly, 1 per second, and do the different mudras. This is called a Dhanu Mudra or a Ganu Mudra. Index finger down is called a Vayu Mudra. This is called a Shrunken Mudra, Prithvi Mudra, Varun Mudra. A lot of mudras are there. Shakti Mudra, Apana Mudra. Let's do it. What we do normal practice, each mudra we do about 20, 30, 40, 50 each. So let's do it on a few mudras, the 5 mudras. We'll do about 20 each, and let's practice. Touch your index finger and thumb. Close your eyes. Keep your spine straight. Bring your awareness to the belly button and push it back very slowly, 1 per second. Bend your index finger down, thumb in the top. This is your Vayu Mudra. It controls all the Vata energy. And you keep on doing it. Let me tell you the benefit of this pranayama. It massages all the internal organs. You keep doing it, 1 per second. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your colon, massages your small intestine. For men, it massages your prostate. For women, it massages your uterus, massages your tubes, massages your ovaries, massages all the intra-abdominal contents. Touch your middle finger and thumb. This is called your Shunya Mudra, improves your hearing. Continue again. Let me tell you the benefits. 1 per second. It hits your diaphragm. Above the diaphragm, the 2 organs, 2 lungs on both sides, and heart in the middle. And if you see, I have made no attempts in breathing in. I just do this to breathe out, and breathing in is automatic, spontaneous, without knowing. This is called a passive breathing. I do the same breathing when I was born. So that I have not, my awareness is only in the belly button to push the belly button in. Touch your ring finger and thumb. This is called Prithvi Mudra. It helps in your obesity and diabetes. So it also removes all the residual functions of the lung, all the toxins of the lung comes out, and you get the fresh oxygen come in. There cannot be a better treatment of COVID-19 than a fresh oxygen. Touch your little finger and thumb. This is called Varun Mudra. It improves your bladder function and the fluid content of your body. Between, you keep on doing it. Between your lung is your heart. So when it Kapalabhati Pranayama, it messages your heart. COVID-19 also affects your heart. And yoga, lung and heart is the same organ. When you massage your heart, heart function gets better. When your heart stops, you do the external massage called CPR, cardiopulmonary resuscitation. You're massaging from inside. We call it internal CPR. This ignites your Agni, the digestive fire. This is called Agni Pradhan Pranayama. But primarily removes all the toxins. It is a forced exhalation and bringing more oxygen in. Alternate nostril breathing quiets down both sides of the brain. So both nostril opens up, you do better breathing. The left hand mudra, call your Dhanu Mudra or Gana Mudra, touch index finger, your thumb. The right hand, close your right nostril, breathe out through your left nostril. Breathe in through your left nostril. Drop your ring finger and little finger, close your left nostril, breathe out through your right nostril. Then breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. Continue this breathing as long as you can, but if you can continue within 5 to 10 minutes. In a daily practice, we do 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. Next, what you do, put your index finger and middle finger in between your eyebrows, third eye. Close your eyes, bring your focus in third eye, continue alternate nostril breathing, and also bring your left hand, holds onto your right ear lobe. It causes your activation of the opposite side of the lobe. It is called your super brain yoga. Alternate nostril breathing with the eyes closed. And focusing into your third eye. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female. Right brain, keep on doing it. I'm telling you the benefit. Right brain is called parasympathetic. Left nostril breathing is cooling. It's called your parasympathetic. Right nostril is controlled by the left brain. Left brain is analytical. Left brain is heating. Left brain is male. Left brain is sympathetic. Right nostril breathing is heating. It is your sympathetic, and it activates both sides of your brain. Initially do it as long as your body will allow you. Into the Bumble Bee breathing, which you already have done before. Closing your all the 5 senses and create your Bumble Bee breathing sound. Do your Ujjayi Pranayama, which is called your victorious. It is a resistive inhalation. You close your throat and try to breathe in. You got a cough because it comes from your vocal cord. It improves your lung function because you're breathing against a resistance called resistive inhalation. You can do the same thing at a resistive exhalation. It's called a Shrunken Pranayama Kongsha. Use a hand as your baby fist. Adi Mudra, put one in the top. Now, you will breathe out first, breathe in through your nostril. You always breathe through your nostril and breathe out through your mouth as if you're pushing against a resistance, like blowing a conch shell. Quieting down your mind, improving the lung function is a therapy of the COVID-19. Relaxation response is an anti-inflammatory, anti-thrombotic, which corrects the cytokine storm, another called bradykinin storm of your COVID-19. Finally, the improving the immunity, powerful tool is your sleep. When you get a sleep, people ask me how long I sleep, 6 hours, 8 hours. No, sleep has a different cycle. One is called REM sleep, rapid eye movement sleep, which you have your mind is still active, like you are all dreaming there. Non-REM sleep. Non-REM sleep has a stage 1, stage 2, stage 3, stage 4, and stage 3 and stage 4 are the deeper sleep. You sleep like a baby. When you sleep like a baby, if you see how the baby has slept, baby always sleeps well. This is called your laying down closed angle pose. You'll be laying down and be sure your head is supported, the chin, and looking straight high up or not looking high up here. Then you take both the feet together and drop it down. You'll see the babies, all the babies sleep like this. Then you include your breathing. You bring your breathing called abdominal breathing. You'll see a baby breath. Hands on both sides. When you're breathing in, you see your stomach will go high up. Breathe out, stomach will go in. Then what you do, you practice a little bit of a longer exhalation and the breath holding. The way to do it, breathe out first. Breathe in with a count of 4 in. Breathe out with a count of 8 out. One more time, count of 4 in and count of 8 out. By this time, you see after 4 or 5 breathing, your sleep is going to come. Then you incorporate your breath holding. 1:4:2. Count of 4 in, count of 16 hold, count of 8 out. I give you count of 4 in. First, breathe out first, count of 4 in. Hold for a count of 16. Breathe out with the count of 8 out. Let's do one more time. Breathe in with the count of 4 in. Hold for a count of 16. Breathe out at the count of 8 out. Then you sleep like a yogi. Yogis first sleeps on the right side in a fetal position. Then the right side, they'll put the hand here over their hand and they will keep in a fetal position. After a while, on your right side, they'll turn onto the left side and they generally sleep on the left side. They're having pillows, they'll put their hands like this. And for us, we can put a little pillow underneath. I can put hands, I sleep like this all the time. And when I sleep like this, I sleep for a long, long time. And the deeper sleep, called stage 3 and stage 4 sleep, is better and better. When you get it better and better in deeper sleep, you develop a wonderful immunity. Slowly you get up again, straighten up your leg, put your hand and sit down in a cross-legged position and finish again with your palming and cupping. Take both the hands, keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses, take your hands, put it over both the eyes, take the eyes, take all the heat from your hand. You massage your forehead, massage your eyes, massage your face and head and neck. It's a wonderful practice. So thank you for joining the class. We have a few more minutes. We generally finish around 5:45. So what I will do, I will like to invite all of you. And Ravi, if you can take me off from the spotlight view, and any of you have any questions, any comments, you can unmute yourself. You can ask a question or you can make a comment. Please join. Turn on your camera so we can see all of you, see how you're doing. This is a very serious time for us.